Hello everyone!
I am ZULUETA
Angelo TAPANG.
NNABUEZA Queenesther.
and our topic is
Eyes trauma.
After the lecture, an infomercial about
HIV and AIDS.
will be presented.
Hello guys! Are you ready for the lecture? I think you are ready. Let's start with the definition.
Did you know, eye trauma refers to the damage caused by a direct blow to the eye. The trauma may affect not only the eye, but the surrounding area including the adjacent tissue and bone structure.
Let's start with the assessment.
The aim of the assessment is to understand the mechanism and nature of the injury, identify associated injuries, identify factors that could worsen outcome, decide whether referral is necessary, and if so, immediately or later.
What's up, guys? There is also an examination.
Examination starts with visual acuities of both eyes. Preferably use a Snelling chart. If this is not possible, document what the patient can see. Example, sign in the waiting room, finger counting, and light perception. Examine the eyes from front to back, doing as much as your equipment allows. Perform a functional examination. Movement of the eyes. Ask about diplopia before and during examination. Pupil reaction test, visual test. Test for relative afferent pupillary defect if possible.
Hello, I'll be the one to discuss the types of eye trauma. Most often the result of a liquid splashing into the eye. Many chemicals such as soap, sunscreen, and even tear gas are merely irritants to the eye and do not usually cause permanent damage. The most common symptoms manage immediately using the 3 I's: irrigate, irrigate, and irrigate. The single most important thing to do for chemical exposures is to perform first aid. A video will be presented about it.
What do you do when you get a chemical splash in the eye? Very important for you to wash the eye out. If it's yourself, you can get in the shower and you can wash it out. Get underneath the faucet and you want to wash it out. If it's another person and you want to help them out, you can lie them on the floor and you can steadily put in cold water to flush that eye. You want to do it for at least 20 minutes. Really flush it in there. Hold the eye visibly open. You need to hold it yourself or help your friend or help your neighbor. Hold it open because you don't want to keep blinking it. You want to get anything that's in there out. And you want a nice steady stream of cold water for at least 20 minutes. You want to remove any kind of contact lenses. Kind of brush away any kind of debris around the eye, if there is any, and you want to call for medical help.
Lacerations to the cornea and the sclera. These injuries are potentially very serious and are frequently associated with trauma from sharp objects made of metal or glass. Do not attempt to put anything directly on the eyeball. Do not take aspirin for any pain because this will increase the risk of bleeding. Edema is the result of bleeding in the eye that occurs in the front part of the eye, called the anterior chamber. The anterior chamber is normally filled with clear fluid called the aqueous fluid. Orbital fractures are breaks of the facial bones surrounding the eye. An orbital blowout fracture is a break in the thin bone that forms the floor of the orbit and supports the eye. Symptoms include pain, especially with movement of the eyes, double vision that disappears when one eye is covered, and eyelid swelling which can worsen after nose glowing. Apply ice to the face to reduce swelling. Generally, a foreign body is a small piece of metal, wood, or plastic. Corneal foreign bodies, intraorbital foreign bodies, intraocular foreign bodies. Foreign bodies that are not removed with gentle washing should be evaluated by an ophthalmologist. This is the collection of blood lying on the surface of the white of the eye, which is the sclera. Generally, this condition by itself is painless. Vision is not affected. The eye will have a red spot of blood on the sclera. This occurs when there is a rupture of small blood vessels on the surface of the eye. Minimal treatment is needed. If unaccompanied by any other eye injury, avoid further trauma to the eye, such as rubbing. This injury will heal with time.
Hello guys, this is the end of our lecture. Hope you learned something from that, and through our lecture you'll be able to love and care for your eyes.
Thank you for watching. Know your limits.
Think before you act.
Be protected.